Let's go.
Sure.
Okay, welcome, everybody. We're gonna start this meeting. I will say that Ryan Wood is at another meeting that got moved. He's at the Half Moon Lake Association meeting because of some scheduling, so sorry, he's not here, so he has to be there. Okay, so I will take a motion to approve the agenda.
I move to approve the agenda as presented.
Second.
All in favor? Say aye.
Aye.
Opposed, same sign. All right, public comment?
Minutes. Did you skip one?
Pardon? Oh, you're right. You're right. Sorry. Thanks, John. Make a motion to approve the agenda of minutes from the August 8th meeting.
So move.
I'll second.
All in favor?
Aye.
Both same sign. All right, public comment. Supervisors not seated as committee members. Anyone here? All right. Okay, number 6, update from Golden Age Manor audit, staffing and financials. Is this you or is this? Do we have her on somewhere? Do you know, Tanya, where she is? Should we hold on that one?
Madam Chair, can I make comments on that? I don't know if anybody knows this, but in the state budget, we have the same allocation total for the state. What is disastrous to Polk County is they reallocated the funding. And the purpose of it was the county nursing homes, and I believe there's only, in the last 5 years, I think we've lost about 20. And I think there's probably, they fluctuate, so I can't give you a direct number. I think there's probably 28 county nursing homes left out of the 72 counties. And so the county nursing homes that were losing money, they took money from those that were fluent, balanced budget, and they reallocated it. Just for an example, Racine County Nursing Home was granted $81 million. And our Polk County Nursing Home, I believe, is $700,000 less than last year. So we're really in trouble. And I'm on the steering committee for the state convention. And so I go to 4 district meetings a year. And our state convention is next Sunday, Monday, and Tuesday in Wisconsin Dells. And this on the last 4 steering committees, I got 6 resolutions passed. Our county, I don't believe, has ever had a resolution passed in our to our state legislature. And so Sunday, our state convention starts Sunday at 1 o'clock in Wisconsin Dells. And I got 6 resolutions I'm introducing from Polk County. And one of them is to reallocate nursing homes.
And that's the resolution. I think we had passed it at the board last month.
Started with our board.
Came here first and then, yeah.
Started with our board. Actually, it started in the committee and then to our board. And then I took it to the state steering committee and it got it passed at the steering committee. So we'll be voting on it I think all 6 of them are gonna be passed.
Yeah, thanks for that reminder. It's an interesting budget issue.
Dana will be on in a couple minutes to talk staffing. She doesn't have financials prepared.
Okay. Do we want to shift around the agenda a little bit here? Is there anything that we can do? And budget will probably be a big amount of time. How much time? Depends on our question.
Brief, it's all good news.
Do you want to take a crack at that and then we'll go back to Dana?
All good news?
It's all good.
That's not what I've been hearing.
How many donuts did you have?
Very positive.
Do you want another cup of coffee?
I feel like I need my back jacket.
Oh, no. No, you've been telling us all the bad news.
Yeah. Okay, let's talk about where we are in our budget process. So Claire will take us to the slide that you've seen a few times already, I think. We've been talking about budget for 3 months already, and it's kind of strange to have a graph that shows us starting right now, but this is really our last week where we're in committees with budget information. Then we move into sort of the full board. So this coming Tuesday, Vince will prepare or provide you with a budget overview as well as a condition of the county report. We'll have in October an opportunity for you to think about the budget overall. You'll get a draft budget book in October on the 17th. And we'd like for you to review that and pass it as is. We published the budget, the October budget in the paper on the 24th or so. And then on the 14th of November, you have your last crack at it. And then it's final because the governor says it has to be. So that's kind of the process we're in. We're ahead of where we were last year.
Yeah, we are.
And we'll go to the next slide. In looking at public health, that's HRC and GAM. And overall, we're real close to balancing right now, which is great. The administrator on Tuesday will show a list of additional funding requests from all the committees. It'll be broken out into capital requests, really two kinds of capital requests. Those that we will internally fund through our sort of family loan fund that the county has, the 110 fund. And then those where we'll be seeking approval for either use of the 22 surplus or bonding. So list about $1.2 million for the projects that we're going to request that you help us fund either with surplus dollars or with bonds. I think for the departments that you oversee, things are looking pretty good. Dana is going to get on in a little bit, and they had a challenging year last year, as Supervisor Bonaprise indicated. But they've done a lot to try to correct that. So I think things are looking good. They've got a positive net right now.
Oh, wow.
Remaining unknowns, budgetarily positive net. It's a plan. Remaining unknowns, we are beginning negotiations with deputies union. And really can't say much more about it than that. But it's a little bit of an unknown because it's a negotiation. And then we're really still trying to get a handle on healthcare expense. I believe I mentioned at this committee last time. If I didn't, I apologize. That our stop loss premium doubled for 2024.
Yeah.
Yeah, from 440 to 880K. That's because our insurers have been dealing with a lot of high claim individuals, so they pass those expenses back to us. So we're looking at that stop loss situation. We're also looking at modifying our health plan to encourage healthier behaviors on the part of our individuals, members, and provide some new alternatives for folks in terms of taking care of themselves. So that's what I got for budget. You'll get a clear big picture next Tuesday from the administrator. Any questions?
Do you have another?
Oh, I got one more slide. What am I talking about?
I got a question there.
Yes, sir.
On the WP contract, that's the only union contract we have, isn't it, for our deputies?
That's correct, sir. Yes, sir.
And just so you people know that, that's a real tough contract. It's the only union contract that the county has. And that one's gonna be hard to balance out.
So that contract gets negotiated and then the result of that hits the budget when and how do we absorb that mid stride?
Well,
It would
we'd
be
like to
like-
think that we'll be able to negotiate. We're gonna negotiate in good faith with the union and hopefully come to resolution. It would go to arbitration if we can't do that. But everybody wants to get this done late September or October, so we can get into the budget.
So we are pretty optimistic that we will get a final contract with them before our final budget.
I remain optimistic until I'm told not to.
Till the donuts are gone.
That's our man.
Thank you, Tanya. I just wanted to point something out. A while back, you and the full board approved a great new option for the county. That's a consortium model for the WIC program and hiring a director that will work out of this office. And I just wanted to indicate, so we don't lose track of it as much as anything else, we are going to need to do a grade increase on an open FTE that Tanya has in her organization. There's no cost to that. We have to keep track of it because if at some point we turn this off and don't do it anymore, we'll have to dial that position back down to the level that it's at right now. But I just wanted to indicate this. So it's a no dollar additional request. I don't know if it's a funding request, as it doesn't cost anything. But to make you aware that that's what's gonna happen. So
Do you need anything from us, like a motion on that or anything? We're good.
it will be in the budget. So when you approve the budget, that's how it will be approved for the next year.
Okay. Do you guys have any questions on the previous stuff? I have a couple questions. One is on healthcare. At what point do we, I don't know, look at entirely different model as opposed to the being self-insured, like actually get a policy? Or is that kind of this hybrid thing that you're sort of talking about? Why don't we like
Yeah,
at some point pull the
started
plug on this
thinking
model?
about, I mean, right now, we're just trying to get in, get the plan set for 24. But we are looking at alternatives.
So we're thinking about a way to not have to, okay.
Well, we're self-funded and generally organizations of our size, it makes sense to do that. We have a variety of plans, options, and there's not a lot of dollar difference between the two traditional plans we have and the high deductible plan. And all three are very favorable to families, which is a good thing for an organization that supports families. Comparing ourselves to other counties, things look different in terms of that split. So I guess, we need to look at, bless you.
Thank you.
We need to look at the number of plans that we have. They're all kind of munged together. We need to offer some more separation and increase incentives for positive behaviors and figure out ways that folks that have conditions can have alternatives that allow them to remain healthy, but maybe cost us a little bit less. So this is a big issue. I mean,
So it's, okay, so it's being noodled around in some.
it is, and we'd be happy to report on where, we stand at any given time on that. Be happy to do that for this committee. So.
And then the other question I've had that I've asked several times is, for the other committee, we have this 50% fund balance thing where we have basically, I think of it as a savings account. I don't know how to exactly think about it, but it's this, and other counties have a lesser amount. And I've always sort of wondered, this came up last time, two audits ago, where the auditor was kind of like, well, this is kind of a big chunk of cash that we're holding in reserve. And I still kind of wonder about this when we're being asked to absorb whatever number of hundreds of thousands of dollars in cuts. So that's still an issue for me, where we have this big fund balance, yet we're being asked in this department to make cuts. So can we just stop making cuts and keep the fund balance?
Well, it's the board's decision about how much we hold in reserve down to a minimum that the state sets in terms of statute. So we're
And
well
what's that,
above that right
what's
now.
the minimum?
It's
35,
But I'm not an attorney. Is it 25?
25,
2025.
and we're twice that.
Yeah, but let me reframe kind of what you asked a little bit, if I may. And one, it's not just this division that we're monitoring expenses. We're trying to keep things under control in all divisions. Secondly, we're not that much out of whack with other counties. There are several counties at 50%. There are some with more. There, 25 was the minimum. I think we had it at like 30 or 35% a couple of years ago when the board voted to raise it to 50%.
Oh, yeah,
So,
I guess we.
so it's something that you can address, but it has to be done in a resolution with the full board for them to say, let's.
To change our
vote
fund
to
balance.
Change that.
And maybe the committee should talk about that, or I don't know, at some point, okay.
One thing I'll mention is we had some very unusual years with COVID and the amount of money that flowed into the system
Mm,
from the federal government. And frankly, our budget models didn't line up effectively with the money that was flowing in. And so we've posted some significant surpluses. I can assure you that we're tightening things up.
mm.
And we're tightening things up in two ways. One is there's very little money, zero money flowing from COVID or ARPA dollars at this point. So we're having to budget more carefully, but also more accurately. So I would be surprised if we return the kinds of surpluses we have in the future. I would love if we did, it would be operational excellence at that point, not just money flowing in and in some cases, the inability to hire and spend our money. So I think there's a lot of moving parts. I recognize the need for operational dollars. Absolutely so.
Did we turn back, did this department turn back?
Mhm.
How much did we turn back?
June,
300,000.
300 plus,
300?
362, something like that, I think it was. I don't know what the audited final was.
Oh, it's right here. Let me
Well,
find it.
Yeah, I mean, the general fund spent about $31 last year, so bless you.
Thank you.
There's 16 million at that 50% rule, 15 and a half, bless you again, would be available for projects of the county, but a lot of that's already committed. So the administrator on Tuesday will show you what we're gonna ask for in terms of using the surplus from the past year for projects in 2024.
And I know there's always this resistance to that we're only supposed to be using the surplus for
Capital.
one time, yeah, capital.
Well, the idea is that it's because it's savings, we want to invest, but that we don't want to fund operations out of our capital account essentially. And as we tighten up, perhaps we, in addition to budget directors, managers feeling like the press is always on them, perhaps we'll be able to go the other way. We just don't know because we're coming out of this period of just craziness. And I think things are settling in.
And Malia has been here, Mr. Bonaprise has been here a while. It wasn't that long ago when this county was at the opposite end of the spectrum.
Oh, I know. I remember.
And so there's always that fear as you start building up that savings account, that it's easy for a 2-year body of government to say, let's spend it. I got something I want,
Right.
or we need, and so that's part of the bias is to keep things,
Right.
not spending it on operations, that type.
Go ahead, Jim.
Don, I got a couple questions and comments. First of all, a comment, I hope that we keep our fund balance. We voted to get it up to about 50%, and the counties that do have that insurance plan, those are the ones that are around 50%, they're in good shape, and I hope that we need keep it right around 50%. The question I have in our insurance plan, do we give any credit for individuals or families that have a supplement? Can you explain a little bit how supplemental insurance would work with our system?
I'm not exactly sure what, maybe I'll just briefly describe the health plan, and if I hit what you're talking about, let me know, and if I don't, let me know. So we have a way for families and individuals to reduce the cost of their health plan through sort of a healthy behaviors program.
Correct.
So if you check all the boxes on that for this plan year, you get $55 off a month. So that's an incentive to do good things for yourself and for your family health-wise. I don't know if that's what you mean by a supplement or not. We have various sort of add-on plans to help individuals deal with time away from work that beyond what they might have PTO for. So in addition, we have short-term disability as an example. We have long-term disability that's an elective. So there are ways that folks can sort of surround their plan with more benefits and more options. We also, of course, have life insurance and supplemental life on top of that. So I'm not sure that answers.
That's what I
Okay.
meant by supplemental insurance.
Yeah.
Besides.
So my wife's
what
taking
we
out a
offer-
lot on me.
What we offer, there's all kinds of plans out there, and some of them do sign up for.
Yes, absolutely so.
So do we give some kind of credit, or how do you address that within our system?
It's pay as, if you want the supplemental, you just elect how much you want and you pay for it.
Yeah.
Out of your own pocket.
So
So
it's
there's a
really
base level
immaterial
related to your
us if
salary.
we have that or not. Okay, thank you.
Yeah, the last couple of plans that I was involved with in the corporate world. So once a year before like October, they would come in and you do a healthcare assessment. They would do a blood draw, body fat, weights, all that good stuff. Biometrics.
Yep.
And then you would be charged accordingly if you were a smoker or obese or something along
So we have all the
those
sort of
lines.
positive side, but there's no dings in our,
Yeah, you're just giving it credit.
get a credit, but no dings.
Motorcycle riders.
Yeah.
Scuba divers.
That don't wear helmets, yeah.
I think the farmers could have another one.
Absolutely, those PTO shafts.
Anybody else have a question?
Okay,
Thanks, Don.
thank you.
I'll just add this little supplemental that we provided.
This is the handout?
explain it. Yeah, the handout.
We have this.
So when we were asked to prepare our budgets back in May, I think we started working on this as a leadership team on either where we could cut expenses or generate more revenues. So this is just a snapshot of what we were able to do as a team. So good credit to our leadership for finding ways to reduce some of our expenses by 123,000 across the division, as well as increasing those revenues. And that's where they got really creative and looked at that whole division model of how we can cross over and realize some revenue generation by thinking outside of the box. So good for them for putting this together. Also, we have the water lab that we've added in public health. So we estimated a little bit low. We don't know. This is our first year of having our doors open. So we'll see what that looks like. Additionally, we took on some fiscal responsibilities for some consortium work that we're doing. These are revenues that go to the business and operations unit for basically processing and administering programs for multiple counties in which we get paid to be the bookkeepers for it. We have a high acuity grant with 3 other counties, and we're also working on that WIC merger that we talked about with the 3 other counties. So those are some additional revenues that we were able to bring in for basically doing the same amount of work, just eliminating duplication. And then we also like to point out that to help our partners in the county, we offer our psychiatric services at the Medicaid rate, which is a fraction of what it costs us. We provide that in kind, so we're not billing the jail the full cost of psychiatric services. We also provide that psychiatric nurse as part of our psychiatry services. And then we also do the clinical supervision for treatment court, which helps them to maximize their grants. So those things that we can do that are built into our system already are helping those other services across the county to be able to meet their needs and do it in a cost-effective way. So altogether, I think The expenses and revenues is about 400,000. Then there's the fiscal lead work that we're doing, that's 76,000, that will fluctuate a little bit as those grants come and go.
That's impressive.
Yeah, well done.
Tanya, what does client contributions mean?
So that's when somebody is in placement through us, we charge a portion to them for their cost of care, based on what they can afford.
So that's a category that you use.
Mhm.
Thank you.
Anybody else?
And other billables, for example, what is that?
So,
Yeah, you.
yeah, so like we bill insurance and other plans for the different things, so it's just kind of a lump instead of breaking out all the different things we may bill. Just kind of lumped it together, after comparing what we've been, because CLTS has had a big push for more consumers on it, so just increasing that we are spending more time with those consumers and it's billable to, it's a Medicaid state.
Those are
program. Children's law services,
Yeah.
yeah. So just that's the main one in that category, but then other things too.
Anybody else? Thank you. Okay, are we done then with budget, everything else got done yet? Okay. Are we ready for Dana?
Looks like she's on.
Okay. Maybe.
Be joining as a panelist soon. Oh, there she is.
Hi, Dana.
Hello, everyone.
Thank you.
Yeah,
So we have you on our agenda for an kind of update, and if you want to just give us a whatever on staff, you said your financials weren't quite ready, that's fine. So tell us where you're at.
yeah. So I missed the very beginning of the meeting, so I apologize, but I've been on since then. Let's see. So there was some talk about, last year's financials. So I can just touch briefly on that again. We did talk about that throughout the year last year, I know, on this committee with the change in the supplemental payment methodology. So it was about $717,000 that we were expecting to get that we did not. The good news for moving forward with that methodology and with some changes that are hopefully taking place, the way that they changed it is to cover all the facilities' direct care losses. So our rate or our amount will go up. It won't be as high as we had, previously had, but we were able to budget better for the upcoming year. So, and I was just on a call a few weeks ago, I guess, and with the increase in the Medicaid rates, there may not be all of that supplemental payment money may not be needed to cover all the direct care losses anymore. But again, we'll kind of wait and see about that. As far as staffing goes, we've definitely seen an uptick in applications and for local people to looking for jobs. So that's been great. We've been able to hire a few full-time people. So really excited about that. We have the lowest amount of travelers that we've had in a long time. We also have I don't have the number right in front of me, but around 10 high school students between 16 and 18 that are working for us as CNAs that have been trained. So that's really exciting to have those younger employees interested in the CNA work and in long-term care. So that's exciting. We've talked a little bit on this committee about the foreign recruitment. That process is still a long ways out there. The last I heard, we were still looking at possibly 2 years. So we're really just kind of hanging tight on that, waiting to see what happens. So, yeah.
Thank you. Anybody have questions for you?
Can you turn it off?
We're gonna get a phone figured out here.
Sure.
Anybody have questions?
Yeah, on that foreign recruitment, how close are we to getting some of those permanent or?
Yeah, so the last update I got, it's still about 2 years out. And I'm hoping they're under promising so they can over deliver, but I'm not sure that that's the case. It's, the visas that are hard to come by, but, we have gone through the first steps with that foreign, labor attorney, but they can't give us any sort of time frame. So that was the last they told me is, up to 2 years still. So no real update there.
A long time.
Yeah, definitely. Because we're about almost 18 months into the process.
Wow. Do we have some people in training that might be coming full-time pretty soon?
Well, we've hired three full-time people in the last few weeks here, so that's really positive. We also, I should touch on our CNA training program. I submitted the application for us to do in-house training, submitted that back in June. They say it's about a 90-day process. We're probably about day 100 right now. So I've heard a little bit from them, but they have to do a site visit. They have a few more steps that they need to do, but hopeful that will get approved to make training even easier for us. And that will be a key thing that we need to have in place when we do have the foreign workforce, because they will need to be trained in Wisconsin to be a CNA, even though they've been caregivers, most of them for many, many years, but they'll still need to be placed on the Wisconsin CNA registry.
Okay.
Yeah.
Anybody else?
Are you holding the capacity right around 62?
Right around there. We're a little lower today, but it ebbs and flows with people discharging, back home after rehab, things like that. So right around there.
Okay, thanks, Dana.
Thank you.
Madam
good?
Chair,
I actually have
Oh,
one.
I'm sorry.
question. I have one question, Dana.
Yeah.
With your immigration lawyer, does that have to be a Wisconsin or a local person, or how does that work?
No, so we're working with a company right now that's worked, that I was introduced to at a convention spring convention for Leading Age Wisconsin, the long-term care association for nonprofit and government nursing homes. So it's someone that they've worked with and other member facilities have worked with. The company is actually based out of California, but several facilities, including Barron, others in the area have used this company. So it's an attorney. I'm not honestly sure where she exactly works out of, but the company is actually out of California.
I see.
Yep.
I just know some good immigration lawyers, and I didn't know
Okay.
what your stipulations were, but
Yeah.
you're already on board with them.
Right. Yep. Yeah.
Anybody else?
just a comment. My partner had a stroke and she was in Golden Age there for 6 weeks. I was there every day for
Yeah,
6 weeks. And at one time, the reason why I asked that question of foreign help, at one time, we were really excited. It sounded like we might be getting 4 people. And
yeah.
what block started but I think as provision for the future, I think nursing homes and once it gets through the lawyer process, we're gonna be getting some foreign help
Yeah.
in different areas. There's people out there, that are to get the right training.
Yeah, I agree. And Dana,
We're just in a dire need.
right,
There was days that when they had to cut different things because they
right.
couldn't fulfill the
Right.
facility.
Yeah, it's good that you're thinking long-term on, it might be 2-3 years out on this foreign service or foreign recruit piece, but who knows where we'll be in 2 years? We might,
Right.
so.
Yep.
Okay, anything else?
Thanks, Dana.
Thank you so
Thank
much.
you. Yep. Thank you.
Okay. Okay, now we're gonna jump down to number 8. Update on child support. Thank you.
There isn't a whole lot. to report that's new. Our performance numbers keep creeping up though, so that's positive. Our court order rate is at an 86.39%. That's 8.2% higher than last year at this time. So I think we're doing well. Fraternity is 106.25, which we're holding our own. It's about the same as it was last year at this time. Our current support order, that's where we're having our trouble. We're right below the mandated 80%, and we just can't get that bump to meet the 80. It's a lot to do with getting an income withholding established, getting a payer to pay. And that's why we've increased our court hearings. We're enforcing court-wise much more than we have the last couple of years. Our arrears percentage is at 72.96, and it's below the 80%, but it's a 2.7 increase from last year. So we've increased our arrears collection as well, and I think that's a positive for us. That's about it.
And the regional folks that keep an eye on how we're doing are pretty impressed with the increases that we've had over the last year. So we're increasing faster than other counties when they're trying to right the ship. And I can tell you, Joe Loso handles most of the child support court hearings, and he was gone at a conference, was it last week? Yeah. And I had to cover all the child support court, and it was a lot. So they're certainly doing a lot more than when I used to handle most of the child support hearings, just from that snapshot. So I think what they're doing is, if somebody isn't paying and it's been a couple of months, they're getting into court right away to find out what's going on, rather than waiting until they're 6-9 months in arrears. So we're dealing with things faster. So hopefully we'll keep seeing those numbers go up.
Great, thank you.
Great.
Any questions? Okay, wonderful. Thank you for coming in. Okay,
Chair,
yes.
I just
Sure,
wanted to
John.
comment. The whole thing, child support system, there's some big changes, but I was on a child support committee for about 10 years. And like she said, Malia, it's just mind boggling in collections and the things that happen in that system. Them people deserve a world of credit. In our guardian ad litem systems, Malia, do we have many people in that situation?
Guardians ad litem are attorneys that are appointed to represent the best interests of children.
Correct.
So we deal with them in a lot of different cases. Mostly I deal with them in like child welfare cases, but often they are involved in family court actions when there's disputes about custody and placement. And we've got, I don't know, maybe a handful of relatively local guardians ad litem that are assigned to the majority of our cases, and I think we have good relationships with.
That was kind of my question. Are the guardian ad litem people all within our county?
I mean, our county, Burnett County and St. Croix County, the majority are from those 3 counties.
That's a tough situation for families sometimes, getting along with guardian ad litem.
That's why we have bulletproof glass in the child support office.
And you need it.
Malia, I noticed that there is a CASA in St. Croix County. Were we gonna, I think I talked to you about this before. Are we considering?
Yeah, so we had CASA is court appointed special advocate. It is a non-lawyer who either has some historic education or training or background that makes them particularly valuable in evaluating the welfare of children. And this is usually in family court cases, not in child welfare cases. So instead of having an attorney who maybe doesn't have any children of their own going and saying, yeah, that house looks better than that house, and I'm exaggerating a little, of course, but having somebody maybe that has a background in child psychology or social work,
Our former circuit court judge, Molly Gale Wyrick, when she moved over to her retirement home in Montana, became a court-appointed special advocate over there because she had, you know, an interest in children's welfare. We did look at a CASA program, Judge Tolan. I think maybe somebody else from my office went up to Burnett County, met with Judge Mogan, because we were looking at maybe having a joint CASA program. We applied for funding, we did not get it, so we'll keep looking at it. But first you have to find folks who are willing to volunteer, because they're not getting paid. And then you've got to create the program and figure out how to monitor it and all of that, but it's definitely something that has value.
They have one in St. Croix.
Yes, they
Well, that's a good question, Denise, because that's something I was interested in. I always thought there was more valuable people out there than what the ones we were using.
I think it might be, I don't want to say it, a best kept secret for,
Well, in Minnesota, the guardian ad litem system is very different. In Minnesota, a guardian ad litem is usually not an attorney, and they are more like a CASA representative. And then if the guardian ad litem needs legal representation, they appoint an attorney to represent the viewpoint of the guardian ad litem. I think that's a much better system than our system.
It is.
Yeah.
But I think the problem is when you're dealing with just the attorneys, like the families and the people, it's harder to relate to them, where in Minnesota, I think they have a better coordination with probably more ordinary people in the system.
Yeah, I would agree with you.
Great.
Okay. Anything else? You good? You good? Okay, thank you. So number 9 is veterans mid-year, and I thought last time, didn't we say, was this the month you and I said, let Andy do his job? Remember we said that?
Yeah.
We were like, we don't need his an update. So I don't,
Yeah, I don't see him
Well,
here.
I have a concern, if I may.
Yeah.
And sorry, I'm having, words are hard today.
it's okay.
So I've written several letters to senators, governors, about Tuberville blocking the appointments of senior military officers. And the help me out. Thank you.
You know, together now.
No, right? If it has more than one slot. Anyway, so, you know, I've got 2 kids in the military, and one is a senior officer. And they are feeling the pain to the extreme level right now. With transfers, only people, but besides people getting stuck overseas, having their orders being held and canceled, along with their promotions and appointments. So, is there anything that, I mean, if it was coming out of this CVSO's office, is there something that the county, I like something to present over at the.
It's pretty interesting. I would think it would start with grassroots and yeah, if we could originate something here, I could take it to the steering committee and yeah, you're looking for a voice to.
Well, yeah. Hey, Andy, we're talking Department of Defense stuff right now.
Oh, yeah?
Yeah.
Sorry, I'm late.
It's okay.
Again.
Just in time.
I'm wondering about drafting like a resolution, or not a resolution, but
You could draft it, but
whatever about these appointments that are being held up in Congress right now. And the
Politicizing.
thank you, of the military.
My understanding is that the Senate could take up each of these people individually. And I would certainly encourage them to, especially the service chiefs and the joint chief chairman should all be taken up individually. And it would take a lot of time on the Senate floor, but hey, they're not doing much else there,
Right.
except going on vacation.
They're not doing their job,
There's three-
really.
That's
There's
fine.
300 appointments.
I know.
Or at least, but I think if you, what the doctor is saying, if you start those individual votes, they're gonna be like, okay, let's give in and
I
just take
think
care
what
of it.
Amy suggests is you could always say, I want to do a resolution, a lobbying resolution to forward. On the other hand, I would say as a federal political issue, it wouldn't be committing a lot of local staff effort on that. So I would recommend that, as Mr. Bonaprice said, make it a local grassroots issue. But if you want to bring it to the attention of the full board with a lobbying resolution, that might be a way to go.
You could bring a lobbying resolution to this committee. We could pass it out of here or not, whatever, and then it goes to the full board. And Tanya and I can help you with that, but.
Yeah, but that's gonna be too late. I mean, we're talking, that's a month and a half from now.
Oh, you think
I'm
that's gonna be too
certainly
late?
hoping that they square it away by then.
I don't know. It might still be timely.
They're gonna shut down the government first. and-
Yeah.
Well, think about that, Denise. That's the one, I don't know, is there any
Can you
other
write a
option?
resolution quickly?
Yeah, I don't know how else we'll do it.
Yeah, I
What
mean,
else can we do?
If you need any, Denise, if you need any help from Andy Phillips, our state attorney, he's got an open door, and I really think you have a little conversation with him. Andy would really know where you're at, and I think he could help you on a route to go.
I think that's a good idea.
All right, I'll get with you later.
Yeah.
Andy, is there anything that other counties are dealing with as far as your positions go on having these guys not being promoted? I mean, what's the word here? Well, she was talking about Senator Tuberville's holdup on all those promotions in the Senate for the military. And one senator is holding all those positions up.
And that's him.
So honestly, I don't know. I haven't been following that at all, so I have no idea.
Okay.
To tell you the truth, I try to watch as little as news as possible.
Okay.
Tuberville's in the news and maybe
yeah.
in the hot seat. Let's hope so.
Okay, Andy, we can, do you want to do your report?
Sure, I can.
Are you good? Thank you.
So I do have my mid-annual report, which I can go over, but I kind of feel like that's boring. And as far as just talking about numbers and things like that, but I can do that. Otherwise, if anybody has any questions as far as like regarding directly with what I do specifically on the things that I can list off, I mean, ask away, because I want you guys to be informed of what I'm doing, of course, and instead of me just standing up here rambling off numbers. But essentially, anytime a new veteran comes in, we have to do what's called a power of attorney. So it's a limited use power of attorney, allowing me to represent them or serve them as their county veteran service officer. So from January to June, we had 86 new veterans come in. And that could also include surviving spouses. Disability compensation claims. So anytime a veteran has a service-connected disability, we can get them service-connected and potentially compensated for those injuries or illnesses. So first half of the year, we did 46. Just to give you an idea, the month of August for disability compensation claims alone, I think we're closer to 40 just for the month of August because of the passing of the PACT Act. So, I mean, veterans are coming out of the woodwork, thankfully, to get the benefits that they're entitled to. So it's been extremely busy and it's been great. Another thing that I like to talk about, and I don't have the actual figures, but if the board or the committee would like me to start tracking, I can kind of give you guys a general idea of what Polk County veterans or widows receive in retro payments. Basically, when a veteran or a widow is awarded compensation, the VA back pays, so they back pay to the date of application or when the law changed, or could be several different things. I think this year, the largest retro payment that we saw come through, I wanna say it was like $250,000. So this is life-changing benefits that are being awarded to veterans and surviving spouses. And that's kind of the things that really make us excited, you know, start dancing on the desk in our offices to see those large retro payments come through. And a lot of that money, of course, comes right back to the county. So we find it very important because it's life-changing and chances are it stays locally, so. DIC claims, dependency indemnity compensation, so we did 10 claims for that last year, or I'm sorry, January through June. DIC dependency indemnity compensation, that's a survivor's benefit if a veteran dies due to a service-related condition. Kind of the common thing that we're doing now for widows is Agent Orange presumptive conditions and cause of death. So if a veteran was in country Vietnam, within 12 nautical miles of the coast of Vietnam, in Thailand, Guam, Laos, Cambodia, the VA automatically assumed that they were exposed to Agent Orange. There are certain illnesses and cancers that are associated with that exposure. So if they die due to one of those conditions or even a contributing factor, that surviving spouse is eligible for benefits. Let's see, I mean, do you guys want me to just keep going through this list, or? I don't like doing the mid-year report, because I just feel like I'm up here rambling off numbers.
I do think though this is important because we don't hear this on a throughout the year, so maybe one time a year, if you give us kind of just an idea of the numbers in the programs, I think that's helpful.
Okay.
If that's.
I agree.
Yeah.
Is it possible, when you do your report, just to send out a printed copy to every one of us, and then we can just kind of follow that right down the line?
Yeah, absolutely, I can do that.
Or even just having it on a slide.
Yeah, either way.
I
That'd
think,
be
Yeah.
yeah,
I don't need the
I like that. That's something we can take home.
Yeah, so I think, you know, it's kind of, you know, Rick had done his thing in the past for reports, and when I came in, I kind of just followed suit of what he was doing to the best of my knowledge, but just standing up here and talking about numbers without you guys knowing what they mean.
Except you're telling us what they mean.
Sure.
So I like, it gives a sense of what you're actually up
It's
to,
actually
so the
good.
numbers. And the other thing I would say is, like, it's great to hear what's happened because of the PACT Act.
Mhm.
So I want to hear the numbers, but I also want to hear what strikes you about the numbers. Like, what are you noticing? What's different? What's surprising you? What's concerning you? So to me, it's not just a recitation of the numbers. I think your insight about the numbers is really helpful.
Yeah, so regarding specifically that, even with the PACT Act, so we're seeing a lot of, you know, post 9/11 veterans coming in now, because even we're under the PACT Act, basically there's the burn pit exposure. So any veteran who was in Southwest Asia, essentially post 9/11 or even Gulf War Desert Storm, they're exposed to burn pits, which are certain toxins that cause certain cancers and illnesses. So again, it's just like the Vietnam with Agent Orange. The younger veterans are now that era or generation. Yes.
So the one thing I do know about Agent Orange is that their children of veterans were also affected. Did the PACT Act?
So no, still currently as of today, under current law, the only childhood illness that is basically acknowledged by VA is spina bifida. And that would have to be a female veteran exposed. So it's, and I don't know all the, you know, medical and scientific research behind it, but supposedly that's the only, you know, evidence that supports that condition. Even at that, so, and here's another thing, we've had, you know, Polk County veterans come forward talking about birth defects, you know, post 9/11 veterans, children with birth defects, problems with getting pregnant, things of that nature. There isn't any health registry or anything for those service members. I reached out to Senator Baldwin's office to see if I could get her on board to try to come up with something where the VA will at least give these people a place to go to express their health concerns, potential grievances. Cause right now there's nothing. So I don't know if that's something, you know, you guys could get behind and somehow support, but if we could see some type of health registry for post 9/11 veterans regarding specifically children and birth defects, just like you know, with the Vietnam era.
Yeah, I know a couple, 3, 4,
Yeah,
Agent Orange kids.
so
Keep track of that just within our county?
say that again,
You
please.
keep track of that within our county, with the stuff that you're hearing,
I mean, might as well.
like a little mini registry?
Yeah.
Yes, yes.
Cause that could almost be like a template for other counties, or we weave that into a resolution in the future that says, look, we've been doing this, this is kind of what it looks like, we think, I don't know, John should take it to the state and lobby for it at the state of Wisconsin, and then we bring on Senator Baldwin, and then I don't, you know, I mean, it's the grassroots piece. So the fact that you're already tracking that's kind of intriguing, interesting,
Yeah, and
and
I
it's
guarantee,
important.
I guarantee you there's more out there that
Yeah.
I'm not even aware
Oh,
of. These
I'm
are
sure.
just the ones that have, and that's a difficult conversation to have. you
Right.
know, If they're, you
Most
know,
of them are adults.
what's that?
Most of them are likely adults.
For
Well,
Agent
then I'm
Orange.
saying like the adults not able to have children or their child have died from birth defects and other things like that. So, yeah, I know that there's more that haven't said anything to me.
I think that would be a worthwhile thing that you could do to ask those questions when you interview the veteran. You know,
Just to keep track.
and get kind of a picture of how big is the problem.
Yeah,
And then I think as Amy said, we could maybe have a resolution that John could take to the counties association and state of Wisconsin and start the process of lobbying rolling. Because then if you have some facts, I don't think that our senators can really ignore that.
Oh, they can.
I know they can.
Are you in communication with other offices around the region or the
Oh, yeah.
state?
Yep,
And
so-
is there a way that the larger community tending to veterans in the state of Wisconsin can sort of start gathering more data, or doing something beyond our county in a coordinated way, so that there's not just this lone voice from Polk County, but maybe there's other county boards that could sort of all feed into it together?
See, that's the key. Anything that I take to the state of Wisconsin, starting with the steering committee and grassroots, it has to be something that affects all the counties.
Yeah.
You can't
It does.
take anything
Yeah.
in
this
the
would be clearly-
resolution form,
Good point.
particular to Polk County.
so,
But in this case, yeah, this is something I'm sure.
Statewide problem.
I
How
would-
do, Dr. Lungus, I was gonna ask you, how do, so medical facilities, when you have females that come in, males that come in when people are going to get pregnant or birth defects, et cetera, how do those medical facilities do their medical records? I would take it that would be a great source of information.
like, are they screening exposures?
I
and
don't
things
know
like
that. That would be a question that Dr. Lungus can answer.
Yeah, I think so. They are screening.
They probably are.
Yeah, they probably are.
interested.
I mean.
But I,
when
you know, and I
it-
understand HIPAA, but how could you grab those statistics that the medical facilities have and push that forward in your resolution by, you know, you can always muddle everything up by giving them really good facts.
Well, but the question is, the birth defects are, do we have background in terms of, do they have Agent Orange exposure? May or may not.
Are they veteran? Do they have Agent Orange exposure? Also, all the other multiple things that can cause birth
Correct.
defects should be in a good assessment for fertility and that kind of thing. But the thing is, how can you point it to the fact that I mean, you know, there's other factors that contribute.
Right, so you can't, but the VA needs to offer a place for these veterans to go so they can start that study to figure out if it is related from those toxic exposures. Right now, they're getting a cold shoulder saying, well, there's nothing we can do about it and there's nothing we're going to do about it.
So is that the ask? Is the ask for the Veterans Administration to do this study? It's like an
Correct.
epidemiological study.
Give the veterans a place to go to share their toxic exposures and the birth defects or situations that they've had with their children.
And have the VA run the study nationwide
You know,
based on your.
Well, it only
control.
took them 50 years to come up with the PACT Act.
right?
So
Yeah.
how are you gonna, I just can't even wrap my
And then they,
head
the
around.
study, they'd
any
have
of
to
that.
control for other variables and look at those, you know, the ones that had the Agent Orange, but not this and this and this, you know, and then.
Probably the same consortium that got the back.
I
What
think
do
it
you-
was
What I
tort-
will
tort
do is I'll be
lawyers.
talking to Andy
Tort
Phillips
lawyers.
Yeah.
Sunday, Monday, Tuesday.
They're the ones. with
And I'll have some discussions about the concern
the- and
That's
all
what they
the-
do.
and maybe I can even touch base with you, Steve. And he's very, very caring and he digs into things pretty well.
And even, so it's more than just Agent Orange even. So it's burn pit exposure, so
Yeah.
toxins exposed from that.
If he hears this from you in conversation, that's what we need.
It's
Yes.
kind of like, oh, sorry, go ahead.
Have you been doing anything with Camp Lejeune guys coming in? Or
Absolutely.
girls
Yep.
coming in?
Yeah.
What's this? Can you update us?
If you're stationed at Camp, you know, I mean, that's the way I think all of this starts rolling is you get a bunch of tort lawyers that gather a bunch of same profile people based on an incident. And then you start sticking
There's so much, I mean,
you're
with,
sticking the needle in. I mean, any base that you're, I mean, let's just,
there's no OSHA. There's no OSHA in the military. You think of all the military specific exposures. So you don't even have to have a veteran that was overseas or anything like that. You could have them down at Fort McClellan, which is now closed, but that used to be the national or nuclear, biological and chemical plant down there. And it's like, you have veterans exposed
Mhm.
everywhere and the VA isn't doing anything to even address birth defects.
I don't think the government starts doing anything until these tort lawyers start sticking the knife in and twisting it and poking it and stuff. I
It
mean, I
costs
think
you
that's
money.
what that's what you're doing. You see it all the time on, you know, if you watch any kind of TV,
Yeah.
the ads come up. If you did this, if you were.
And going back to your question, yes, so as far as the county veteran service officers, there's a national, state and regional association that I belong to. So I can bring this, or ask the state CVSO president to basically address this and somehow, you know, get on board, have him get on board to help coming up with a solution to push us forward.
I think
Just
that's
to
an
get more
excellent-
information statewide.
Yeah.
How about just taking care of the veteran, right?
What's that?
Just do what's right, take care of the vet.
That's it. That's the agreement. Nothing more, nothing less.
Right.
I think you're onto something. I
Mhm.
like it. And I think from a medical perspective,
Yeah.
it would be really nice to have this body of data and have whatever it is, an epidemiological study or something. I think keep noodling that and we can help in whatever you want us to do.
Okay.
So yeah, I like it. Do you have more numbers that we're so eager to hear about?
Property tax credit. So, yeah,
wanna
so
hear
this is
about
another
that.
good one. So
Don's interested.
Wow.
January through June, if for anybody who's not familiar, Wisconsin does have a disabled veteran and surviving spouses property tax credit program. Where essentially if a veteran is 100% service connected disabled, or if the surviving spouse is eligible for dependency indemnity compensation, they're eligible for a credit through Wisconsin Department of Revenue for their primary residence and up to 1 acre of land.
Does it have to be 100% disabled?
No, so, and that's a great question. So anywhere from 70% combined service connected rating, but they're deemed individually unemployable through the Department of Veteran Affairs. So January through June, we had 23 new veterans or surviving spouses become eligible for the property tax credit program. So,
Nice.
yeah, I mean, you could have a homeowner on Balsam Lake with 1 acre of land, and if their property taxes are 12 grand each year, they're gonna get that back from the Department of Revenue, so.
But do they have to be of employable age? What about if they're retired?
Doesn't matter. If they meet the state's requirements, being 100% or granted individual unemployability, or if they're a surviving spouse of a veteran who died due to a service-connected disability, they're eligible for it. I think at the state level, they're trying to get it reduced, or they've been trying to get it reduced, starting at 70%, where they'll more or less prorate or do a percentage somehow. Someone down at the state actually, I don't know what happened, but they want to now propose a means test where they would potentially have financial eligibility requirements tied into that somehow, but who knows what's gonna happen.
Or they want taxes?
Interesting, great.
That's income.
That's all the excitement I really have.
That was good. You even dance on your desks there. That's so good.
Yeah.
Great.
Like to see that.
Rita wants to come. Thank you for your good work.
Thanks,
That's
Andy.
great. Yeah.
Sorry I was late again.
No, you're good. Thank you,
We're right in
thank you.
time.
Okay. Housing, update on housing.
Yeah, I'll just give you a brief update on what we're doing and what's gonna transpire next. We've been putting together a questionnaire or application for tribes or local communities to apply for the housing grants. So we've got a draft. We're gonna fine tune it. I think in October, we will bring that forward to general government in this committee and probably show it to the board next month. I think the thought being is as if we can get these out to the local governments, November, December timeframe, if they want to apply, we could start doing it in January or whenever they come in.
Okay.
But that's kind of what we're working toward. The goal is to make this thing directed toward the type of housing that we have specified. And, I think the local communities I've talked with have all said kind of the same thing. It's like, hey, it's better than nothing. And yeah, we'd be interested. So as they start talking to developers or organizations in their communities, they'll consider this. Once the application comes in, our thought being that a committee would review them that would include the county administrator, the county board chair, and the director of the EDC. So, as a place to start, and then it would come to the full board. So.
Great. Any questions? Thank you. I'm glad that's moving along. Okay, number 11, communicable disease report. Helen.
Sure, numbers are looking pretty similar to last August. Our tick-borne illnesses last August was 4, this August was 6. Lyme's last August was 11, this one was 17. COVID last year was 400, this year 49 confirmed cases. STDs, chlamydia staying the same at 6, more gonorrhea though this year, so.
And how about any West Nile virus?
Yeah, that's good.
Nothing that meets the state's definition of reportable. I think there were some that were tested, but nothing came through.
I have a
Any
question.
other viral diseases?
Yep, there's a handful of like 1s and 2s, a Hep B, Campylobacteriosis, chlamydia, gonorrhea, Hep B, and Lyme.
So they're no worse than before.
Correct. And that's what meets the confirmed documented cases. So yeah, there's
Sure.
definitely a lot more stuff coming through.
Yeah.
Nobody's tested.
Go ahead.
And when he's done, I have a
Well,
question.
yeah, I have some other comments if I could make them at this time. I'm sure you've heard about in the news, there's a new virus, BA 2.86. I'm not sure how. There's been some fear that's gonna be more invasive, but I think now that what I read in the last week is that maybe less invasive than initially feared. And since 2020, life expectancy due to COVID-19 has gone from 80 years to 77 years.
Oh, interesting.
And there's really concern about the RSV virus. So they're encouraging children to be vaccinated and also adults 65 plus to be vaccinated.
RSV.
Last minute, so Mike Osterholm, who I get all these reports from his SIDRAP email, I get a report 5 days a week about what's going on. Infectious diseases in my phone. And so I have all these reports, and his feeling is, and he's been at the University of Minnesota for decades and is an advisor to President Biden. And he feels that people over 65 should get their RSV vaccine already last month. So check with your clinics to find out if it's available. And then the FDA approved, I think yesterday, the Moderna and the Pfizer vaccines for the COVID boosters.
They were approved.
And we don't know how soon they'll be available in your clinics. There's also been a concern for athletes getting myocarditis or inflammation of their heart. I think the problem was with that J&J vaccine more than the other two vaccines from Pfizer and Moderna. And so this study was done, came out yesterday, a couple of days ago. Elite athletes, they have no long-term heart damage after COVID at 2 months post-infection. And I think the recommendation for people who have not had any vaccinations, that they get a COVID vaccine 2 months after their infection. So if anybody wonders if they got that, and that would really give them a tremendous amount of immunity for quite a long time, so getting it from the disease plus the vaccine. And so there's still more hospitalizations in the last 2 weeks in the US and increasing death again from COVID. And mostly is people who have not been vaccinated at all. And it's interesting that there are more COVID deaths in red states versus white or blue states because of the lack of vaccination.
Oh, yeah, sure.
And the disinformation on the safety of the vaccines. So getting back to Dr. Mike Osterholm's recommendation, get your RSV vaccine now and get your booster a week or two later. And then he has done, I do what he has recommended for years. I wait until I hear that there's flu infections going in Polk County, then I go to my clinic and get my flu shot. Because because the immunity from flu lasts about 6 months. And if we have early flu season, you obviously want to get them as early as possible. So that's why I do it. If we get flu early in October, for instance, I would get my flu shot in October. But if we don't see anything until November, I don't get my flu shot until November because I want it to last through March. Because some years we've had really a peak of flu in March, and if you get to get your flu shot in September,
Yeah.
that immunity may not last.
I saw that all the time at Mayo. We get April, March and April flu.
Yeah.
You know, people got their shots in September,
Yeah,
you know, so they don't even start giving them till November unless it's an unusual year and you're getting flu,
right,
like you
right.
said.
right, so that's hopeful that information is useful to
Thank
all.
you. That's very interesting.
Well,
Any-
not having anything to do with communicable diseases,
Right,
but I also saw that they have fentanyl over the, or not, Narcan over the counter
that's true, yes.
for
Yeah, I think it's an
Fentanyl and-
inhaled product.
opioid.
Yeah, so if you have,
On program.
so if you have
Yeah.
family members at risk, you can go to the pharmacy and see if you can buy them.
Yep, we have a website, our Narcan website, where you can go and see where you can be trained to administer Narcan, and you can get free doses at no cost, or the local pharmacies that are carrying it. Some are requiring a doctor's prescription, some are over the counter. So it's all kind of there in one snapshot of where in Polk County could you get Narcan. Interesting.
That's good.
Yeah. Thank you.
Is there any, so I've seen plenty of videos where Narcan is administered and the addict is really upset because it takes their high away like instantaneously.
Too bad.
But
Interesting.
what does Narcan do? You know what, like, what are the side effects? What's the?
Save lives.
I know, but I'm thinking
I
you
know.
got some in the medicine
Yeah, I
cabinet
wonder.
and you got teenagers in the house.
So there's no contraindication. So
That's
if
what I'm
you
talking about.
think
Okay,
that
good.
it might be an overdose, you should use it, because if it's not, then there's going to be no
So
harm.
if you got kids pulling it off the shelf and, I mean, they're not gonna.
Nope, they won't get any
Happen.
rise out of it.
The only harm would be to intentionally give it to someone so they have that withdrawal, just to make them mad.
Just to make them mad.
Exactly, that'd be the
Okay.
only thing.
Interesting.
Uh,
That's a good question.
Hold down your kid. Shove it out.
Here. Okay. Anything else on this topic? Okay, legislative event. Did you have anything else, John, that you?
There's just
told us?
one other thing I think our committee people should be interested in it. It's not introduced by the committee, but our sheriff's department has a resolution which approved and I'll be introducing. And the rural, like if you start probably at Bayfield, all the counties kind of on the edge of the big population areas, their fire department, their EMS, some of them, they're just understaffed and underfunded. So I'm gonna be introducing a resolution from Polk County to from the surplus fund, take $33.5 per capita to fund rural fire and EMS. And there's, Wisconsin has a fund balance. And could you find a better place for it than helping our rural fire department, EMS and that, and so that would solve the problem. I believe right out here, I think town of Lincoln and a few of them have went together, and so hopefully we'll have enough interest next Sunday to get that funded out of our state fund balance,
Thank
which
you.
I think is what, $7 billion?
Yeah, well, I think that we've relied on volunteer fire departments and other volunteers. And I think that we really have to get to a point where we're actually paying these fire departments
Yeah.
to be firemen
This is what we need as of right now, emergency.
and pay for
situation,
EMS
because
services. pay
They're
for-
understaffed and they can't operate in
Yeah.
this.
We can't expect people to become volunteers and take time out of their families and their jobs and not be compensated.
This is just another way where our legislature, you know, they're just underfunding counties and municipalities and let's step up and get
Thank
this
you.
done.
Yeah, that's good. Okay. All right, anything else on that? You're good? All right, so our next meeting items.
I don't know if this is on that, but I was just looking at the minutes and there's a person who's a citizen member who I've never seen here, a Sabrina, somebody.
Oh, Sabrina?
Yeah.
Yeah.
And I'm just curious about,
She on it?
I don't think so.
Is Sabrina on?
No, Sabrina. Anyway, I don't know if Sabrina's been here on Zoom and I haven't known that, but I was all of a sudden just kind of looking at that and thought, well,
She was here
she here?
in the August
okay,
for the public hearing. I believe she came in person. that
okay.
time.
I just have never
Was it
met her,
last month?
so.
This says last, members present last time. She's not.
Yeah.
She wasn't here for the,
That
mean,
is.
but that was
yeah.
for the meeting. I don't know the public hearing. That's,
Anyway, I'm just
Yeah.
curious about, like, who is that?
Okay.
And have I met her? I don't think so. Anyway,
we'll have her wave at us next time.
okay,
Cause she works in Cumberland?
She works at Cumberland Hospital. nurse
Okay.
practitioner.
anyway.
I'll ask her if she's able to make it in person for the next.
Well, I don't know,
meeting.
I'm not demanding an in-person
Mhm.
thing. I just don't remember ever
Or even-
connecting with
even
the
if she would
person in
come
the
by
year.
Zoom.
What's
What?
that?
Even if she would come by Zoom.
Yeah,
Yeah, put her in
Anyway.
as a panelist and.
well,
pop
she
her-
does,
She's often there.
participate by Zoom.
Okay, that's good.
Okay.
Track of that
That's
more
good to
than-
know.
We just don't have her face up there. Maybe we could have her wave at us.
All right. I've never met her either. Okay.
So Tanya, what do we got? We got budget amendments on our normal work plan here, but maybe that's
Well,
done.
yeah, it seems like you should have the budget before you go ahead and make
Amendments,
amendments to
Yeah,
it.
yeah.
yeah, so. How do you wanna do
So,
that?
Don, how do you think that will roll out with when the budget is distributed, printed?
Right, so the September meeting of the full board, the administrator provides a high-level overview. And there's not significant detail in that budget presentation. The real detail comes in October. So I think maybe off by a month, if I'm understanding things
So does that mean
correctly.
you want us to do that in
Should we,
November? But that's too late, isn't it?
should we provide the budget and then have the amendments at the November 14th? So when does the budget get passed?
November 14th is.
Is that the
for
day?
When the budget gets approved.
That's our final, that's
Too late.
statute.
That's too late.
So what is our question, is is your department gonna be asking for an extended spectrum balance in?
Well, I guess what we need to know from the committee is at what level of detail do you want to see the budget? And so you have the opportunity to suggest amendments.
So could we do a detailed budget conversation on October 10th and then we could have the morning of the 14th for discussion about amendments. We could also talk about amendments on the October 10th. And then it goes to the full board that evening. Is that gonna work?
So what's in the budget book is, sure, all of you have your budget book from 2023 with you, right?
Yes, we carried
Uh,
around.
Had two, don't we?
Yes, good. So, yeah, it's on page 31, it begins.
I guess I'm confused, is our department gonna be asking for an amendment or an adjustment, or where are we at here? I didn't expect one.
We're operating under what orders we've been given. We believe we'll have a balanced budget to present to you, but I believe this committee then needs to support it and push it forward to county board.
So it might not, there might
Or
not
you-
be any.
And you have the
amendments, but-
opportunity
There might not be
to
any.
suggest amendments.
Yeah, just,
I'm sure hoping that we don't have any amendments or.
Could I just would be helpful if I
Yeah.
provided some sort of 30,000-foot view of what you'll have at the October meeting. It is a budget that is not particularly granular, it's high level. And what generally the board has done is have discussions about funding requests rather than detailed budget specifics. So as an example, last year, between the October full board meeting and the November full board meeting, there were discussions about a number of projects that were circulated in committee. And at the November meeting, some decisions were made, including to spend more money on the Justice Center roof to fund recycling, add some additional dollars to recycling. And so in the past, things may have been different, but that's what happened last year. You know, we work under county administrator form of government, and the assumption is that the depth of the budget is managed by the administrator, the division directors, without a lot of need for committees to burrow into the details. So what would an amendment look like? An amendment might look like, well, I don't want to even say anything because not wanting to spend money.
Well, just say you had an amendment from the recycle center or something like that.
Okay, so let's use that as an example. Let's say we wanted to run a new kind of plastics line at the recycling center that seemed like a great idea. Then that would be proposed at Public Works Committee, since we're focusing on recycling right now. And the full board would have an opportunity to discuss that in November and make a decision about that additional funding. So you could imagine a number of things that you as a committee might want to do related to your committee. And you could advance those, having looked at the budget book in October, recognizing that your project's not in there, and then bring it up in November.
So are we gonna have the budget like we did last year where there was kind of your list of things that you'd already decided to for sure fund? And then there was the other list of things that people could make a motion to
Yeah,
fund. It's gonna look like
general-
that?
It's kind of in the past, we've said, here are the things that I provisionally approve. Here's some things which I've left out of the budget. And then it was like a menu to you. We'll probably have something like that, though I have to, one of the things that's been good this year, the directors have done a great job because of the situation to be less liberal with their requests. So we don't have as many, and I've given provisional approval to many of them, if not all. But there might be a few that as we look at the budget numbers as they come down, I may say, this one has to step over here, which in turn, you guys may have that option. It's just something, it's not like I decide and I'm the be all end all in terms of what we do. But I do some preliminary approvals of adjustments. So
When it comes to the budget, you are the hatchet man.
well, a little bit, yes. So, but we'll see what it looks like, the final numbers. And then I'll decide if, generally what I'll do is I'll say, we gotta be balanced, so I'll take a few things out. Then I say, what if the board says, no, we really want this, then we'll just have to figure out a way how to pay for it, that type of thing.
So
Could I
between
briefly?
you and Don,
Yeah.
I'm extremely conscious about any kind. We gotta have a balanced budget, and that's our report to the taxpayers.
Yeah.
And so I know there is some of these amendments come in, which, like a few years ago, unbehold to anybody, one supervisor said, we need another, that we funded that extra drug person. And you estimated about all the expenses like 120,000. And that was a shock, but you did get it covered, so we had a balanced budget. Have you heard anything from any of your department heads if there might be some amendments that are?
I'm not aware of any double secret probation amendments that are in the weeds gonna jump out. I haven't
I
heard.
mean, I'm taxing your.
I'm not saying they wouldn't do that, but those come from supervisors, yeah. So, try to discourage.
Don has something to add.
I was just gonna mention that division directors and the administrator, I'm looking at a list of additional funding requests that have been removed. And the number is in excess of $500,000. So, and roughly 3/4 of that is capital and about 1/4 of it's operating. So we got a very large list of additional funding requests. We winnowed it down considerably. And looking at this list, I'm not sure anything is likely to creep back in from the list I'm looking at. But that would be to the discretion of the board. And that's why you're here to discuss these sorts of things.
Okay, so back to what are we gonna do in October? Will we be having enough information to make? You're gonna come in October and we're gonna say, yeah, we love this budget, right? Isn't that the game? plan?
Right. And
So we will have enough above, a little above granular, not granular, to understand. Is that?
there's much less flexibility with operating expense and with capital expense for some of the reasons we talked about earlier. So we're gonna be really tight operationally. We would prefer not to use general fund savings account to fund operations. But all of this is subject to your desires and your votes.
My
You
yipping.
tell that I'm politicking.
You are.
So, okay, so let's talk about the budget on
Our schools
October,
can't have
right?
savings accounts and
I mean,
county should.
I don't
Yeah, I mean, I
know
guess
what else
we
to
can
do.
talk and see like what,
Just me.
what level do you want me to break it down for you?
Maybe the
And
don't not
say-
say-
I don't know, we just have it on our work plan, so I'm happy to, I just want to make sure that we get a little bit more information
Referendum.
evolved.
15,000 foot.
Well,
Give us
Be
15.
the-
yes, and if,
15,000.
if the level of granularity in the
Players
budget
get in the
book
way.
is not
But-
sufficient
but-
for
There's some.
the needs, and you can look at the 2023 version to determine that for yourselves.
Probably be-
We'll go as deep as you want to go.
Okay, yeah, well, I don't, okay,
It's all
so
matter
let's
of
keep it
what
on the
we're-
agenda,
Yeah.
obviously. And then what else we got in here? Division update. Do you want to do that again, or do you feel like the budget piece will be too much and you want to kick that around? Or?
Well, it would be the CSD division update, so if you guys want that.
I mean, either October or November, we could move it
St. Schools.
if the budget piece is gonna be significant enough, you know what I mean? So you can ponder that and bounce it around if you want, because it looks like in November, we're doing all these other updates, so it might kind of just roll. I don't know if we need a November BSO,
14 point.
so maybe we can
million.
put CSD down there. I don't know. Because Andy just came, so, okay.
President.
Any other things for the October agenda? No? All right,
Hearing none, motion to adjourn.
I'll second it.
all in favor?
Hi.
Opposed, same sign. Thank you,
Happy
everybody.
Halloween.